Welcome and thank you so much for joining us today. My name is Allison Rosen and I am a 10-year colorectal cancer survivor. And we're here today for a very important cause. Obviously, it's near and dear to my heart, but it's near and dear to everyone here's heart. I want to say really quickly that this was done 4 years ago, started 4 years ago, with 4 buildings and landmarks turning blue throughout the city of Houston. And now we have between 50 and 70 landmarks that shine brightly blue throughout the city of Houston. And that makes me so proud and so happy that so many people want to work together to help spread awareness about colorectal cancer. A little anecdote for you guys. So I always do this and I tell my parents, and they don't necessarily believe that all the stuff that I do is actually possible, but they see it in the news, they see it on social media. But I came home from a trip and they did their part and they lit their house blue. So their 2 front lights in their house are lit blue and they surprised me. And my parents can't surprise me with anything. I always know what's going on. They live down the street from me, but they surprised me with this. So when I talk about buildings and landmarks and institutions turning blue, everyone can do their part to help support this Blue for CRC initiative. You can get your nails painted blue. You can wear blue any day. We just ask that you post on social media using the hashtag #BlueForCRC so we can all spread awareness about colorectal cancer. Because if I hadn't had my screening, my colonoscopy, I wouldn't be alive before you today. So I'm really, really passionate about this cause, and I'm really, really excited that I'm joined by some amazing speakers, some amazing people to tell you why Colorectal Cancer Awareness Month and the lighting the city blue and wearing blue and talking about it more is so, so important. It's important to so many people, but today we're here to give you a little bit more information about that. So through coordinated efforts between the American Cancer Society and the Colon Cancer Coalition, we're here today with a lovely inflatable colon behind me and blue lights tonight throughout the city. And now we're going to talk about it. So without further ado, I'm going to introduce Jenny Todd, Senior Executive Director for the American Cancer Society.
Thank you, Allison. Colon cancer needs to be talked about. When people see the pink ribbon, they think breast cancer. But colon cancer is the 2nd leading cause of cancer death in the United States, and it's preventable. When Houstonians see blue lights, or people dressed in blue, or a blue ribbon in the month of March, we want them to think of colon cancer awareness and to get screened. Did you know that 1 in 23 Americans will be diagnosed with colorectal cancer in their lifetime? And 1 in 5 of those before the age of 55. The American Cancer Society recommends that adults 45 years of age or older get screened for cancer. An estimated 12,000 Texans will die this year from colorectal cancer, while 4,000 will be newly diagnosed. Don't be one of these numbers. Right now, you could have a polyp or a small growth in your colon or rectum. Right now, it might be harmless, but over time, it could develop into cancer. Preventing colon cancer early is imperative. Through regular screening, you can be diagnosed. The gold standard in testing is colonoscopies, but it isn't the only option. There are other affordable options, including take-home kits that you can do in the comfort of your own home. There's no excuse not to get screened, so please contact your doctor today. Thank you.
So the next, let me move the microphone down. The next speaker is Dr. George Chang, the chair of the Department of Colon and Rectal Surgery at MD Anderson Cancer Center.
Thank you, Allison. I want to thank the American Cancer Society for putting this event together to highlight this really, really important issue. And as Allison mentioned, my name is George Chang, and I'm the chair of the Department of Colorectal Surgery here at MD Anderson. And we're really delighted to join the Texas Medical Center and the City and County of Houston, along with the American Cancer Society, to really raise awareness for colorectal cancer. As you just heard from those very sobering statistics, colorectal cancer is very common. That means for all of you standing around here, you will know someone, or you know someone who has or will be diagnosed with colorectal cancer sometime during their lifetime. And while there are a number of treatments for colorectal cancer, the most effective treatment actually is prevention. Being screened, getting your colonoscopy, or getting detected early in some other way with a lesion that has not yet turned into cancer is the best chance for cure. So I can't emphasize enough the importance for all of us to encourage our family members and friends who are 45 or older, and also those who may be experiencing any symptoms, whether it's blood in the stools or change in the bowel habits, to not be afraid to talk about it, to seek their care with their doctors and get tested. But for those patients who do develop colorectal cancer, there is hope. With the right treatment, most patients who are diagnosed, particularly with early stage colorectal cancer, can be cured and will beat their cancer diagnosis. This is why it's so important that when patients are diagnosed, that they get a complete workup so that the right treatment can be initiated for them, and treatment that's designed to be not only effective against their cancer, but will allow them to get back to their lives and preserve the quality of life and return them to their families and friends and their normal day-to-day. At MD Anderson, here at the Texas Medical Center and throughout our Houston area locations, we're proud to serve Houston and our Texas community and our patients through their journey. And as you have heard, colorectal cancer being diagnosed in young people is increasing all the time. And that is a really important area that we've placed, that we are really working to help improve the experience for our patients and help our young patients get through this journey. And so with that in mind, I'd like to introduce Dr. Nancy Yu, who is one of our faculty in the Department of Colon and Rectal Surgery and leader of our Young-onset colorectal cancer program.
Good morning. Thank you so much for showing up today. Colorectal cancer is increasing among young adults aged between 18 and 50. Did you know that for someone who was born in 1990s, they face twice the risk of being diagnosed with colon cancer and 4 times the risk of being diagnosed with rectal cancer compared to someone who was born in the 1950s. So we have to do something about it. What can we do? I have 3 messages. First, don't be shy. Don't be shy about talking about your bowels. Don't be shy about noticing when there's a change. Please, if you have a symptom that may be consistent with colorectal cancer, go get it checked out. Don't assume anything. Second, take advantage. Those of us who treat colorectal cancer are fortunate because colorectal cancer takes time to develop. So it offers an opportunity for interception. We can stop the process. We can catch it early. So take advantage, get screened, start at age 45, earlier if you have a family history. And third, make it a part of your self-care. Do something today. Go home, either take a family history, or call your doctor, make an appointment, or go online and look at a resource. Do something today. Here at MD Anderson, we have built a dedicated program for young patients with colorectal cancer for those who are diagnosed under age 50. We know it's the last thing that you want to be thrown into your lives. Everyone is busy. We're here to walk every step of the way with you, from early diagnosis to juggling your treatments with everything else in your life to reintegrating into a normal life after treatment. So thank you so much for being here. Get screened.
You've now heard a little bit about the statistics. You've heard a little bit about what's being done locally. I know I told you I was a 10-year early age onset survivor, but now we have a very, very inspiring person to talk about her cancer journey. And really, I want you to listen carefully, because we've talked about the stats, like I said, but the story and the stories of people that have gone through it or are going through it are the most important thing. So without further ado, I have the distinct pleasure of introducing Latasha Poe.
Hello, how you doing? Cancer is unexpected, and in my life, it chose a time where life was going great in my eyes. I was happy, loving life to the fullest. I raised my 3 adult children, been married, and have 1 beautiful granddaughter. God be with me, I felt this to be so unfair. Cancer can be so silent, but once you become diagnosed, it becomes so loud and can take over every part in your life. This was my time, and cancer opposed it. Hi, my name is Latasha. I'm 47 years old. I work for Texas Department of Criminal Justice. I hold a bachelor's degree in criminal justice with a minor in sociology. I have an honorable discharge from the Army Reserves. I was diagnosed with stage 3 colorectal cancer at age 45 in June of 2021, and my first thought was, no, not me. I'm 45, that's all, 45. I haven't begun to live for myself as much as I've lived for others. And facing death wasn't a part of the plan for me. This is not real, nor is this happening, but it was. I received my very first colonoscopy ever in May 2021. I remember the doctor telling me the age limit had recently changed from 50 to 45, and was that my reason for coming? I was unaware of that, but my reason for going was I felt some type of blockage in that area. I wasn't in any pain, and the scary part was that I wasn't in any pain. I can stand here today and say this screening saved my life. After my initial colonoscopy at Memorial Herman Katie, I made an appointment at MD Anderson Cancer Center downtown in Houston, Texas. I never dealt with cancer, so I thought my life would never be the same or normal again. Treatment was a tough decision, but I was grateful to have treatment options. My treatment included taking 35 chemo pills a week and receiving localized radiation at the same time for 5 weeks. After that treatment, I received 8 rounds of intravenous chemotherapy with a take-home chemo pack that pushed medication through my body for another 48 hours before a disconnect. I faced depression, anxiety, sadness, loneliness, doubt, and unexpectancy, not knowing exactly what the future would hold. At first, I wanted to walk away, but I stood in the fire, and I'm a better person for it. I rang the bell after I completed radiation in September 2021. Then I rang the bell again in February 2022 after I completed chemotherapy, giving me a second chance. I cried so many tears of gratitude. I am now 1 year cancer-free and counting. Before I close, I want you to walk away with this in your mind, that anyone at any point and any time in their life can face a cancer diagnosis. But if you're aware of the signs and symptoms and statistics beforehand, then you're more likely to take time out your busy schedules and get tested, get screened, and to share any health concerns, even the simplest of concerns, with your healthcare professional. Time is so precious to us all. And for me, being here on Earth to celebrate and host my granddaughter's 5th birthday party meant the world to me. I'll forever be grateful to the doctors at MD Anderson and the medical advances and God's grace and mercy. Thank you.
What an inspiring story. Screening can save lives. I think it's very simple. Next we have Isaac Middleton, the Chief Operating Officer of the Texas Medical Center.
Wow, that was powerful. Thank you, Latasha, for sharing your story. This is really important. Many believe, as you've heard, that colorectal cancer is something you don't have to worry about to a later stage in life. The important work that the American Cancer Society and all the folks up here around me are doing to get the word out about earlier screenings is crucial, and it saves lives. At the Texas Medical Center, our mission is to advance health, education, and research. We're always proud to support our TMC member initiatives, especially those that are aimed at life-saving awareness, and this is a prime example. So TMC will be lending a hand by lighting up our campus buildings blue throughout the month of March and encouraging all of our member institutions to do the same. For our part, you'll see the TMC police station lit up blue. You'll also see this beautiful water wall behind us lit up blue later on tonight, and many other buildings throughout the TMC. So thank you all for the important work you're doing. And with that, I think it's, I believe, is my honor to introduce Director Stephen Williams from the Houston Health Department. Thank you, sir.
Good morning. On behalf of my boss, Mayor Turner, I want to thank you for allowing me to highlight such an important subject. The mayor couldn't make this event, but he wanted to ensure that we had a City of Houston presence here. It's my understanding that along with Houston City Hall, there are going to be more than 50 other buildings in and around our city that will take place in turning the city blue this month in support of Colorectal Cancer Awareness Month. That deserves a round of applause. I also want to express my gratitude to Latasha and Allison, cancer survivors, for sharing their stories, but because it really presents a very personalized message regarding the importance of cancer awareness campaigns. So thank you, Allison and Latasha. Men have a higher rate of colon cancer than women because some say we're too scared or too embarrassed to talk about it or to get tested. And I'm personally concerned that African American men have the highest rate of colon cancer death in the city of Houston. It's important to know your family history, make healthy choices, and get screened. That point was driven home when I had to comfort and support my mother while she battled colon cancer. For years, my 4 siblings and I got timely screenings. That's why the Houston Health Department is proud to support the 100 Black Men of Houston and Black Vitamin Health and Wellness Fair this Saturday, March the 11th, at our new Sunnyside Multi-Service Center. It's free. It's a free community event, and it's open to the public. Early detection through effective screening plays a vital role in identifying cancer and allows for life-saving treatment options. As men, we need to encourage each other, and women, please encourage your fathers, your husbands, your sons, your friends, and family members to get screened. And better yet, why not just join them? If we do not, people of Houston will be dying, in particular African American men, from a largely preventable disease. Please hear me when I say, go get screened. Early detection is key. Together, we can win this battle. So Allison, I want you to please come forward, bring everybody up here, and I want to actually read a proclamation from the mayor. I think I got the words on a piece of paper so y'all can hold it. Whereas colorectal cancer is the second leading cause of cancer deaths in the U.S. among men, and women combined, there is currently no cure. And whereas 1 in 20 men and 1 in 24 women will be diagnosed with colorectal cancer in their lifetime, and whereas there are now more than 1 million survivors of colorectal cancer in the United States, and whereas the national goal established by the National Colorectal Cancer Roundtable is 80% of Americans ages 45 and older be screened in every community, and whereas if the majority of people in the United States age 45 or older were screened regularly for colorectal cancer, half of all cases could be prevented entirely. It is critical that all people of all ages know the signs and symptoms of the disease. And whereas observing Colorectal Cancer Awareness Month during the month of March provides a special opportunity to offer education on the importance of early detection, the City of Houston encourages all to participate in spreading the awareness of this disease. Therefore, I, not me, Sylvester Turner, the mayor of the City of Houston, proclaim March 2023 as Colorectal Awareness Month in Houston, Texas. I want to thank you again for this opportunity to join you today and your support in spreading colorectal cancer awareness. Congratulations.
Thank you so much.
Thank you for your story.
Thank you.
And thank you for your story. It's time for questions.
Quickly. Yeah. So that concludes our remarks. We're here for anyone that might want to talk to anyone up here. or in the audience for interviews or pictures. I think the take-home message is what everyone said here. Colorectal cancer is preventable, beatable, and treatable. So thank you so much for joining us today. And let's take some pictures in front of this colon and post on social media using the hashtag #BlueForCRC so that we can make sure everyone in the city knows that Colon Cancer Awareness Month is in March. Maybe we can move this. Yeah, let's move this.
It rolls.
Okay.
It's best to roll it this way.